what our fear, we heard this morning the Ministry of Health of Italy, quite with strong statement on vaccination. We recently, in the last couple of weeks, the Ministry of Health in France also came very loud on promoting vaccination, even taking a family that refused to vaccinate their kids on a mandatory vaccination to the court to build a case to make more visibility.
We need to record what you say,
okay.
because, you know, then you didn't say it.
Okay. Anyhow, you got the first part, eh? So, strong statement from the Ministry of Health here in Italy. Other Ministry of Health are raising up. What I really would like to suggest, to call, is that the European Commission is good all the idea of we don't fault, let me put in a very blunt way, that we don't fault in all this traditional debate about subsidiarity, can I do it, how many millimeters I can move it, and all this. That's a momentum. There are some strong political leadership, and we saw also with the national agency here, the fact that a European country, Italy, has taken this important global WHO leadership on immunization. How we can make sure that the Commission dare to do one pace more and move from a coordination, join the pack in leading a transformation in calling for immunization in Europe.
I think from a formal point of view, it will we have to we have to take into account what is our legal basis, and it would still be this discussion about subsidiarity. But I think I agree. Therefore, I think it's important to differentiate between policy makers and decision makers and policy advisors. And I think working with the second one it would be important because this would give this indirect effect we are hoping for. So independent advisory bodies who are really asking for more collaboration and giving them, providing them a stage and really establishing some sort of solid well-structured networks where on a regular basis they could come together and exchange views and share best practice and to support this process, I think in an indirect way would be a step forward. But if we would approach directly decision makers, we would end up in this in this discussion we experienced for such a long time, facing directly an argument telling us, well, it's not our part dealing with immunization because it's national immunization programs, and I think this we should try to avoid.
Any other question? Yes.
Yes, so I'm Sylvain Juchet. I'm representing the COREVAC with the French Vaccine Research Partnership. I was very pleased today that we heard a lot about global research partnership needs. COREVAC, actually at the French national level, is trying to put around the table all vaccine research units, regulators and industrial partners. I'm sure, and we're putting around the table to discuss subjects like vaccine adjuvant or social science and vaccine efficacy, vaccine effectiveness. I'm sure there is other organization like that in Europe. And we heard today about like the European Universities Association, because, for example, one of the problems we're facing with vaccine effectiveness in France is with dealing with large cohorts to measure that, but we don't have a panel big enough to have a good measurement of vaccine effectiveness, for example. So I was wondering what you can do to support the collaboration or the creation, the development of collaboration of partnership like the CORVAC through European or international level.
What we can do as national agencies, what we have just done, and we can really take new leap for what I've gathered from this day. I've learned a lot of things, and I'm sure President Pecorelli will now carry this forward because the need for integration among different stakeholders is absolutely needed. I don't know if WHO would like to make a comment on this, and in specific what was discussed earlier on, and then I will give the mic to that. It's a joke. It's a classical Italian joke.
But it wasn't funny the first time.
Don't touch anything. Good.
Okay, thank you. Actually, I wanted to make two other points, if I may, instead of responding. But we can talk maybe after the session. I'd be very happy to talk to you. It was to two of the speakers. I thought the speakers this afternoon, all of the presentations were very interesting. To Bruce, I wanted to ask a question. So you're importing. I thought it was very brave of you to put this pie chart up, showing the importations from Europe. I don't know what time your flight is, but I hope you make it. But my question is this. The first question was for Bruce, the second was for Gaia. Have you, because the contact tracing, the cost of hospitalizations, the indirect, direct cost of these importations, and these importations leading to outbreaks, how vocal has the US been with EU member states as to those costs? I'm not suggesting you send the EU a bill, but I'm just wondering whether there's an element of political advocacy there that is possibly could be more made explicit to the European countries, that actually we are exporting and it is costing the US a lot of money to deal with these importations. So my question was whether that message had been sent from the US Health Department. That was my first question. My second question was for Gaia, which on the Healthy Foundation. I think that's a fantastic project. It's very interesting. But one of the questions that we're regularly discussing at the moment as we look towards developing curricula for school-based delivery on vaccination is access and a reluctance by education authorities and the ministries of education. So I'm wondering whether you could just tell us a little bit about how you got access to the school system and what your kind of interaction with the education authorities was like.
So, is this working? So we have. I'm not aware that we've sent a bill, but the numbers that you suggested have been calculated about how disruptive these investigations are, and therefore how expensive they are. And we've talked about them in the United States more from a how state and local health departments spend their time, because they're under a lot of pressure to do so many things. And this is one other thing that they get pulled to do that they shouldn't have to do. And so for those reasons, we've talked about that, but use them mostly internally to talk about the importance of supporting our infrastructure rather than pointing a finger about where things came. But those numbers are available. They're published. The article that I took that from, where the importations come from, look at that, and we've had a number of these outbreak investigations where, and I think it's an important point, where those are calculated to try to get an understanding of what this disruption costs in contrast to what a stable program would otherwise deliver.
While Gaia prepares for this, I tell you a story of a similar sensitive issue of highlighting what you just said. Italian children are becoming overly obese. So one of actually the fastest growing percentage of children in all the Western world, up to 14% in certain areas, especially in the South. So the idea The idea was very simple, backed up by all the Ministry of Health and Diabetic Society and stuff like this, and was to bring a scale to elementary school. That's it. And put the kid, as he was dressed and everything, on the scale. The only thing they wanted to do. An uproar on this. Who are you, to judge the way I feed my kid? And do not even try to, they weren't even speaking. They weren't saying anything. They just wanted to have a picture of the situation. So this actually points out exactly what you're saying in how controversial would be, and I expect it would be, to bring informations on anything that relates to vaccination early on. So would gladly if Gaia can tell us how they got a hold of the university and the educational system, because that's exactly what we need.
Well, definitely it was easier with local authorities that were more willing to cooperate with our project. So we actually went there and explained to them our project, and they were actually responding. They responded pretty well to what we presented. It's definitely more difficult to do that nationally. So that's what we're trying to do. That's our next step. But obviously, going over and presenting to the small cities and small authorities, it's definitely easier to do it and get their, get their cooperation. So,
if I may add, we tried in the past going nationally. Okay. Minister, so on and so on. Yes, fantastic idea, and then nothing happened. Because it's not simple, because otherwise, it's a long process. You know very well these things. So that's why I think that once you have a prototype, then you can export the prototype. And this did happen because we started in one city, then went to one region, talking with the head of the region. Then went to another region, saying that that region had said yes, so we are doing that in that region. And so kind of a competition of the two regions, say, okay. And then went to another 7 regions, okay? So little by little, it was like when Italy was united, It took some time. Garibaldi went from Sicily up. But, I mean, at the end of the story, I mean, you have all of the regions together. We have regional health system, as a matter of fact. And this is why, I mean, this could be easily done. Now, what we're trying to do with the universities is we go as universities to the minister of the university and say, hey, listen, I mean, this is our job. And because universities everywhere in the world are made because their fallout is social. There's no doubt about that. Because you are preparing new people for new jobs with the university degrees. You are doing research. And the fallout of research, of course, is what we see every day, even with research in vaccination. So here we are. But I fully understand, I mean, your question. I mean, it's not a simple way. So, but, we are expert in using the Troy's horse, okay? Put everybody into the horse, go in, open up, and then conquer.
Just again, I'd like to make the point I made this morning, say, fantastic, congratulations that you did something or will be doing something in the middle of December, launching the Conclusion Council conclusions. Now, I'm very anxious that we don't lose the momentum on this, because as you explained, initiatives, and they were, and member states fell off and said, no, we can't. I think what we really need to, again, my point this morning was, you do include civil society and pressure groups, advocacy group, not only at European level. It's probably a little bit easier to organize it at a European level because, you know, Europe doesn't have to pay for the vaccination. That's at national. So we have to have advocacy at national level, so top down and bottom up, I think we need, because otherwise there's a danger that it gets talked to death again and nothing happens. And I think that would be a really a terrible, terrible thing if we couldn't use this occasion now. We know about Ebola and we know what could potentially happen. So please, let's not lose the momentum and how we do this communication activity through different stakeholders, but please include them in recommendations there to help. Final word, I really want to see this not getting bogged down in bureaucracy. Thank you very much.
Thank you for these remarks. Indeed, we will, of course, take into full consideration the patient. We go nowhere without the patient in general, but in this case, in worse.
Good afternoon. Thank you for this very interesting meeting. I'm Paolo Durando from the University of Genoa, Italy. During his talk, John Ryan focused on vaccination of healthcare workers. He spoke about influenza vaccination among healthcare workers. It's an opportunity, I think, for us to discuss with the European level and the US. There are some differences, some significant differences about the uptake of flu, but also other vaccination among healthcare workers. I think that is the time, the momentum to share experiences at the European level and to not only to survey the Venice problem surveyed about the uptake among healthcare workers, but we know that in the US 70, 80, 90% have been reported. At the European community, we have a medium less than 30% of uptake. I think that that is the moment not only to survey but also to act to improve this. It's not only nosocomial prevention but also an attitude of healthcare workers. If we are convinced, we can convince. Thank you.
Yes, I fully agree. So, it was mentioned this high-level hearing we have in mind to organize then spring next year, and it's about really understanding the findings of the paper we issued about the shortcomings, and also understanding and discussing ideas for improvement. But then also, of course, sharing quite concrete information and giving examples of best practice, and also providing member states with an overview of national immunization programs, influenza immunization programs, and discussing about concrete steps which could be done to improve the implementation, and regarding also having the opportunity to discuss a possible review of programs. So it was mentioned expanding the scope of an influenza immunization program, really discussing on an evidence base, considering having children in the recommendation as well, and also giving us the opportunity to discuss, well, we have existing recommendations go quite far with regard to some of the target groups, but there is a significant lack of data, so there is also an inconsistency with regard to that, and all this should be discussed at such a meeting.
Thank you. Any other comment? Bruce.
So I think your point about influenza is a good one, and I tried to make a pitch to measles, and how a measles focus could help you understand not only how you're going to get there, but how to improve the systems along the way. And I think that a parallel effort could be done with influenza, and for a number of reasons. Some people look at the United States as we are extreme in how much influenza vaccine that we use. And the numbers you cited as far as the use of influenza vaccine in healthcare workers has changed substantially for a number of reasons. But I think when you look at the recent SAGE recommendations, I think that's an important piece, particularly about vaccines in pregnancy, which is an area that a lot of people have stayed away from for a long time. But from my perspective, anything was the legacy of 2009 was recognize the importance of influenza vaccine in pregnancy. Obstetricians now realize that, and at least in the United States, are routinely recommending it. Now we're about over 50% of pregnant women every year get a flu vaccine. They're disappointed that they're not going further than that, but before the pandemic, that number was like 10%. And the important message that the doctors are giving their patients is not only is this good for you, but this is actually a benefit to your baby. And so as that data becomes available, and it's something the Gates Foundation, I have nothing to do with them, but they're now looking at that in a very heavy way to try to think about how they can improve maternal health. And there are an increasing number of studies. So I think it gets back to the data. And if people can be persuasive in telling their pregnant patients about how important this is, not only is it safe, but it's good for you and good for the baby, that may go a long way. And I also think that influenza is another aspect, that our seasonal influenza program is essentially our annual exercise in trying to do a mass vaccination program. And if we can't figure out how to do that, when it comes to an emergency, if there are millions of doses of something available, to be able to execute that, to get vaccines where they need to be, to track them, to track their effectiveness and their safety is really important. So I think that separate from measles, I think that a focus on influenza could help to build other parts of the system. You can't take all of them on, but I think the issue you raise is an opportunity to look at a different vaccine, one that's got more of a focus in adults than the childhood vaccine. So I don't know where you take that, but it just seems that of the many different things that you could do, taking a look at those two vaccines could help you to build the systems in which they're developed and delivered.
Thank you. If I, before wrapping up, if I take advantage of the mic and ask a very bad question to Paolo Bonanni. The thing is, and Bruce can interject as well, if you take into account the calendar in the last 30 years, you see a massive difference in the amount of vaccination that are requested, and with the meningococcus B just came in, just squeezing in beside all this, and with a lot of adjuvant to immunize. Now, this game has become very challenging for the immune system. Of course, one of the, and I think you mentioned passing by this, but this requires a little bit more attention. We need to have information to reply to a question like, do you guys know what will happen to the immune system when it gets multiple challenges in such an early age? And it ought to keep the focus, because if by any chance it misfire in terms of what is going on with all these things we're putting together, this is a question we need to answer. Because otherwise, on this, which of course, I know the technicality, but if you agree with me, we need to have some communication on this, because otherwise this will open fields for, can I wait a little bit, why are we getting all this thing all together, do you guys really know what happens to the immune system in this situation, blah, blah, blah. Okay, so sorry if you have already in your field resolved this, I haven't seen this in the literature, but with this vaccination schedule becoming so tight, this could be an issue which requires a lot of communication on our part. Paolo and then Bruce.
But I agree, but I think that it's more a communication issue than a real issue, because as a matter of fact, we don't have any evidence that there is some overload of the immune system, and also the argument of the too many antigens. There are some very nice slides showing that when you gave smallpox vaccine together with the cellular pertussis, you gave over 3,000 proteins, and now you give 130 proteins with all the vaccine together, because we have more purified vaccine. And also for the adjuvant story, I think we don't have really an issue of danger of those vaccination, rather an issue of communicating that that's not dangerous. But we have to show that after tens or hundreds of millions of doses given, we never had any evidence that this is dangerous. So we have the surveillance in place, and we can show that there is really no danger for health.
So I agree fully, and I do think it comes down to, it sounds easy to say communication, but maybe we need to work on what's going to be the most communicative. Exactly as Paolo said, is exactly the case, that you shouldn't confuse the number of needles with the number of antigens. And I think that from a parent's perspective, they've got a little baby, and there's a lot of needles, and the baby ends up crying, so the parents end up crying, and they think they may have done some harm. So I think that trying to get some understanding of that is going to be an important part of it. And with the deference to immunologists are not the people you want to be on the news, because they don't speak English as well. It's hard to communicate these complex thoughts, but I do think that to be able to translate exactly what Paolo said is really important. And in fact, that we have made incredible progress in our vaccines at making them purer over time, so there's less other stuff in them. So I think there's more to that. You mentioned adjuvants. So I think there are a number of issues that it gets back to trying to understand what are the top questions that people have, and then from that, how do we best package the science that we know to be able to answer those questions. And if there's things that we don't know, we should set off to do them and say we're doing that. But I think to then say, no, it's fine, don't worry about it, is not going to be very persuasive. But to be able to explain things in a way that's understandable is really our challenge.
That's my point, yeah. We can't just say, there's enough scientific evidence, dismissed. They're not going to buy this, so.